suppose you're going to bring it back with you. He says, I hope not.
And he's never.
I don't want him to bring any precipitation back right now.
Oh, he ain't gonna stop. Snow. Just enough to kill the mosquitoes.
There you go.
There you go.
It's up in there.
I heard that four-letter word. That's a bad one.
It is, isn't it?
Snow. S-N-O-W.
Not till about 2 days before Christmas.
I do. That's why I clarified the four-letter word I was talking about.
Got a bunch of
It'll hit a holiday. We gotta call in everybody on overtime.
Well, I liked your comment. It's a four-letter word. I mean, your leaves started.
I was gonna get him to drop it, I guess. Right.
Supposed to have a heavy frost right now.
Good evening. Linda Johnson, would you please give the invocation?
Let us pray. Father, you are exalted. You are the King of all kings. You are high and lifted up. We praise your name. Let all the earth rejoice and give you praise. Father, your word says in Psalm 127, except the Lord build the house, they labor in vain that build it. Except the Lord keep the city, the watchman waketh but in vain. Father, we invite your presence here tonight to keep our city. As decisions are made here that affect the government, the businesses, the people, and the land. Let every decision here be made in accordance with your plan. Let all that is done be in you, through you, and to you. Father, there's been some violence in our city, Lord, and there are those, Father, that are in floodwaters and turmoil and trauma. Father, this is not your will for our city, Father. So we here tonight come into agreement that violence be eradicated from our city, that the floodwaters cease and those that are in the floods be helped and be out of the poverty and out of those situations for good. Your word says, Father, that we have the authority to trample on the serpent and the scorpion and over all the power of the enemy, and no thing by any means shall harm us. So, Father, we take our authority and we shut the doors of this city, the gates of this city to the violence and to poverty and depression and oppression. We command them to cease and desist. We shut the gates to the death and destruction. And Father, we open our gates of our city to life and prosperity. Lord, let all that is done here tonight lead us along this pathway. In Jesus' name, amen.
Amen. Thank you, Linda. So we will officially call this committee of the whole meeting to order. Madam Clerk, would you please take the roll?
Mayor Miller,
Here.
Alderpersons Clem,
Aye.
McClanathan,
Aye.
Ross,
Aye.
Parker,
Aye.
Busker,
Aye.
Brashaw,
Aye.
Keister is absent, and Chesney.
Aye.
Thank you. And if you could please join us with the Pledge of Allegiance led by Alderman Parker.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And Alderman Parker, it's your meeting.
Okay, thank you. Item 4 is the approval, a motion to approve the agenda.
So moved.
Second.
It was first by Alderman Brashaw, second by Alderman Ross. All in favor, say aye.
Aye.
Opposed? Sorry, I'm new at this, so. All right, item 5, the approval of the minutes from the Committee of the Whole held on September 10th. Is there a motion for approval of the minutes?
So moved.
Second it.
Moved by Alderman Busker, seconded by Ross. Okay, all in favor?
Aye.
Opposed? Thank you. Item number 6 is public comments on the agenda items. Oh, that's what this is, okay. Diane Neal. You like to step up to the podium there? Wonder what that was.
This is on? That's it. All right. I'm here tonight because of the discussion on social media of the Gladewood Bridge, Demeter Bridge. And the social media thing apparently is the immediate one. Started off with an anonymous person on Facebook who calls himself Tutty Baker. And that was echoed by a news source we have locally called Today in the Port, who didn't add any information other than what Tutty Baker originally said. And then you get a whole mess of comments, some of which are informed, some are not informed, some are, there's just quite a range. But the information was not presented. All they were using was apparently a sheet that you guys are going to get tonight, which is a little summary. They didn't have any detailed information. So anyway, we don't have newspapers broadly distributed like we used to. We don't have news media reporting in as much detail as they used to. We really need some way for the city to incorporate all these people that just get going on social media without sufficient information. And I see you're going to have a website discussion later tonight. That may be part of it. But you also need to have somebody really interfacing and watching what's going on out there and trying to respond to it, which I see that Lowell did do some attempts to respond today. But anyway, about the Gladewood Demeter Bridge, people are all talking about, oh, it's just to benefit a few houses, the people live back there, they're all doctors and lawyers anyway. I'm not a doctor or a lawyer, but we've lived there since 2005. And the bridge isn't just used by the residents of Gladewood, it's also used by people from throughout that kind of south area if they need to go toward the east toward downtown rather than toward the west out, towards Highland or somewhere like that. As things are now from our area, you go through the park and then you have to go up Park and then double back toward downtown, whereas when that bridge was working, it was a more direct route. It didn't cause as much extra traffic in the park. But there's other considerations besides that. One is emergency vehicles, which it was discussed in the article and in the responses. Somebody said, well, I had a sprained ankle in the park, and they came down Park and everything was fine. Well, a sprained ankle is not a heart attack. You can probably wait till however the vehicle can get there. House fire, you would want a little faster response than through the park. And it also is used, it always was used when it existed as an exit from the park. Like if there was a concert or something there, people would have more ways that they could get out of the park. And it would be an emergency exit. Say the emergency that happened in the park was one of the other bridges, and you didn't have that access, and you had to route everything out what now would be only one direction. So there's a number of different considerations for this besides all the doctors and lawyers that live down on Gladewood. And the Park District, I believe, is also interested because they would like to be able to close the park and actually say, here's our hours, now right now they can't close it, we have to go through it. That's how we have to get out of our houses. So anyway, that's my comments, but the social media is a problem. Mm-hmm. And the lack of information that people have is a problem, and I'm not sure how we address that, but I wanted to point that out too.
Thank you.
Chair,
Go ahead.
just a quick comment on that. Perhaps we should put on the agenda, maybe we can generate a manager memo on the website where if there are pressing issues that seem to have misinformation, then we can, formally respond to these items rather than getting into, the back and forth on social media. But if we had a platform where we could copy that link and say, well, here's the response to that bridge, because I would agree with Diane, there is a lot of misinformation that can quickly get out of control. So maybe just something to think about.
Mm-hmm.
Any other comments? I like that idea. Okay, item 7 is a presentation of the Freeport Fire Department Paramedic Integrated Health Care with FHN. Chief Allen.
Good evening. Thank you for this opportunity to kind of explain this exciting program. We do have representatives from FHN, Kathy Martinez, who is one of our community partners that we've been able to reach out with, been able to communicate with, and have some discussions on this program. In the audience tonight is Mark Gridley, and Doug Topfer also from FHN. And just to give you a little bit of background of where this program started, FHN saw a need as a stakeholder in the community. They saw a need in the community as related to not only the healthcare issues, but also some of the social aspects and how it relates to healthcare. So they came up with a program called Connect the Dots, and it's Doors of Team Support. And they look at areas such as community transportation, child nutrition, and also some of the elderly nutrition, and then supportive health. And how do we bridge these gaps with people in the community that may already offer those services, but maybe we just haven't connected with them to get this person with this person to help this issue. But overall, those were the social aspects of what they were saying and what they see coming through the ER. And how we started pairing up and teaming up is after we attended monthly meeting after monthly meeting and subgroups, we're seeing all these issues come together, and Kathy and I we're on the same page. We're seeing the same social issues in the field with the fire department as a stakeholder and community partner, just as FHN is as a stakeholder and community partner. And so this where that team kind of merged together, and we said, how can we meet some of these needs? And we came up with this community paramedicine, or mobile integrated healthcare partnership that we've established now with the FHN. So with that, we're going to, Kathy Martinez, we'll have her step up.
Todd, the one thing I want to make sure the council's aware, this is based upon a model that they're already doing in Rockford. And so we would not be while we would be at the front cusp of this has been approved. Larger communities, Champaign has something similar to this, that we would be, at this point, the smallest community to do this. But this is something that is being done in other communities right now.
It is. Yep, that's right. Thank you.
Thank you very much. I'm excited to be here, and I appreciate you taking the time to listen to the chief and I talk about this program. As Chief Allen mentioned, we've been working on this for months, and it really did come to fruition out of our Connect the Dots program. We're lucky enough to be working with Doug Tepfer as our emergency management coordinator as well, and he's really leveraged his relationship with Swedish American from the emergency management perspective. And as Mr. Crow stated, Swedish American does have a well-established program that we will be mimicking after. So to kind of set the stage, I want you to assume a different identity for a few minutes. I want you to assume the identity of a 53-year-old, a person who was diagnosed with diabetes in their mid-30s, a person who has not been able to, because of different life choices, take their medication for their diabetes on a daily basis. About 3 years ago, you were diagnosed with heart failure. And one of the medications that you receive for heart failure is a diuretic. And that diuretic is meant to take some of the fluid off of your body so that your heart can beat more efficiently and effective. But the problem with that is the medication makes you have to use the bathroom frequently. So you only take that medication when you're going to stay at home. You also live in the basement of an apartment with one window, and you have no car. In the last 6 months, you have visited the FHN emergency room 44 times, and you've accessed or called 911 for transportation to the emergency room 28 times. You are now a patient that we want in the mobile integrated healthcare program. And you are a true patient that is experienced between both the Freeport Fire Department and the FHN emergency room. So I think that will help you set the stage for what we are trying to address with this program. Really, what is the mobile integrated healthcare program? It's a patient-centered approach that really sets goals with the patients, but it's an extension of traditional healthcare services. It goes beyond the four walls of the hospital or the four walls of an office practice, and it actually goes into the patient's home environment. Being in the home environment, we are able to learn so much about the patient and why they may not be compliant with the disease program that's set in front of them. One of the things that we're really going to focus on in the mobile integrated healthcare program is that chronic disease management. There's diseases that we know that take up many of the resources between the fire department's 911 center as well as within our organization. We really want to focus on preventive care of these patients. You know, it's flu time right now. We're going to be making sure that that patient is receiving their flu immunization. We're going to make sure that their post-discharge follow-up visits with their primary care provider or their specialist provider are actually attended by the patient. As Chief Ellen stated, our Connect the Dots program is really about connecting with community resources, and between both the paramedic as well as the FHN complex care manager, we're going to get that patient associated with the resources they need. If they need transportation, we're going to get them hooked up with Pretzel City. If they need their medications, we're going to be able to make sure that we're hooked up with the pharmacy or a place that is able to get their medications at a price that they can afford. And the most impressive part of this is the in-person visits through the Freeport Fire Department paramedic as well as the FHN complex care manager. This again allows them into the home. It allows the opportunity to make sure that the patient has the medications that they were supposed to be taking along the way. It's a time for us to be able to look into shelving and look at their food and be able to see if they're eating a low sodium diet instead of that high sodium diet that most of us do consume, and also a physical environment assessment. And that's one of the things that the paramedics do so well. They are our eyes and ears, and they see so much when they're in the homes, and this gives us another ability for them to be able to communicate with us about the patient population within our community. This is a slide from the American Hospital Association, and it really talks about social determinants of health, and this is the new buzzword within healthcare. Those of us in healthcare really thought that we took care of more than 20% of the healthcare needs of our population, and that we had a lot more impact on the health and well-being of the community. But this slide really demonstrates to you that the patient and the community member, the physical environment, the socioeconomic factors play a much more important role. If the community member decides to smoke or to drink alcohol every day, if we have a high level of pollution within our community, if I graduated from high school or not, if I have a job, if I have a social support system, or am I here by myself without any community resources? My income level, and again, my safety in my community all impact my overall well-being. And I believe this is a very important slide for us as a community to focus on, because it's not just what we as a healthcare organization have to attend to, this is for us as a community. A few years ago, the emergency management system really talked about how to integrate with health services and how to expand the EMS role within population health and within public health. It talks about exactly what the Mobile Integrated Healthcare Program wants to do. It really wants to integrate with other healthcare providers to be an extension of services that we provide and address maybe segments of population that we aren't addressing today. So where did we come up with the need? As Chief Allen described, we've been working on this for a few months, and we really looked at our community health needs assessment as well as the I-plan from the health department. This slide right here really shows us the projected population for age 65 and older, and this is one of the most impressive slides within the community health needs assessment. If you look at Stevenson County from the year 2000 to 2030, we're looking at a 79% increase of those who will be 65 and older. If you really narrow it down just between 2015 and 2020, you see almost a 1,500 population increase in that 65 and older. We know that people that are 65 and older tend to have more chronic diseases. They don't have just one disease primarily. They tend to have 2 or 3, and that increases the complexity of their care. We also know that some of the respondents for the community health needs assessment said, hey, there's a healthcare professional shortage. I can't get into the doctor as quickly as I would like to. We know that that's not just providers and nurses, that's laboratory, that's a multitude of people within the healthcare setting. And we're not unique in Stevenson County. This is a nationwide problem. We also know that they identified that there's issues with transportation and access. Insurance is here, and it's also on the I-plan as an issue. And then we know that low-income families tend to seek primary care in the emergency room. And when we're trying to get patients to receive services at the right place and at the right time, primary care in the emergency room is not it. There's a higher cost associated with those services. If I'm there for a cold or if I'm there for a heart attack, that is a very big difference. We also know that there's 4 different leaders of mortality within Stevenson County, and this isn't really a surprise to many of us. Heart disease, chronic obstructive pulmonary disease, which is a lung disease, it's called COPD, stroke or cerebral vascular accident, and then diabetes. And if you read any type of literature out there, you'll know that one of these diseases does not normally exist without the other. And many times a patient who has heart disease also has COPD, diabetes, and will eventually have a stroke. So these are very interdependent on each other. The I-plan stated, again, very much the same type of issues. Insurance limiting their coverage, the cost of care. It actually identified a lack of access and utilization of the healthcare system by people of color. It talked about education being an issue, and then continued health disparities within our system. So to really get a little bit more close to the vest and really look at our local data, the Centers of Medicaid and Medicare have termed a super utilizer as a person who uses 911 services or visits the emergency room 4 or 5 times per year or more. From January 1 through July 31st, we know that there were over 2,500 calls, EMS calls, for the Freeport Fire Department only. When you look at that, 74% or over 1,800 of those calls actually ended up with a transport to the FHN emergency room. In this same 6 months worth of time, we had 10 patients who visited our emergency room at FHN 239 times. Again, that's in 6 months, and that's 10 patients. We had 9 patients who were readmitted to FHN within 6 months that totaled over $2.3 million worth of charges. And most impressive is we have 1 patient who within a 13-month time period was in the FHN emergency room 116 times. When we look at the potential cost avoidance of the program for a mobile integrated healthcare program, we really look at it for what it can do for the Freeport Fire Department as well as what the impact to FHN will be. So we did some cross comparison. We looked at data and we were very transparent between the fire department and FHN. And we looked at 28 patients. And those 28 patients in 6 months visited the emergency room 188 times. Chief Allen provided a $302 per rig deployment, a net cost of that, which equates to about $57,000 in 6 months, where we believe we could have cost avoidance. When you really look at this patient population of 28 patients, greater than 80% of these patients were either Medicaid or self-pay patients. When we looked at that same group of patients for the cost of an average emergency room visit, the cost of an emergency room visit on average was $983. That equated to $184,000. And then when you looked at the 3-day readmissions for the same group of 28 patients who equated for 58 readmissions, we look at a potential cost avoidance of $758,000. The local data, when we look at it, here's just a quick snapshot of readmissions within the FHN system. 20% of Medicare patients are readmitted within 30 days of discharge. If you go back to that slide where we showed that the age 65 and older is growing, by 2020, we will really be looking at that 20%, and it'll be equating for over 2,000 visits, readmissions within a year of time. So really the key components of the mobile integrated healthcare program is the integration and collaboration. The partnership that we have, again, with the Freeport Fire Department. You can ask our emergency room staff and providers, and they feel that the Freeport Fire Department is one of their own. They are, again, our eyes and ears out in the community. It's a very data-driven program. It is very patient-centered. Again, it's the patient establishing goals versus us. The patient might just want to be able to dance at their daughter's wedding, and if we can get them to that while keeping them not utilizing services as they had in the past, we've been successful. It's a very multidisciplinary approach, and it's team-based. So while the Freeport Department paramedic will be working with that complex care manager nurse from FHN, there's new access to the providers within FHN, to different services, and again, to different resources within the community. The program is tailored, again, to individuals, so it's very educationally appropriate. It's not a one-size-fits-all program for everyone. And again, we think through the cost avoidance, it is financially sustainable. At this time, the mobile integrated healthcare programs across the country are not receiving reimbursement. There are some states that are starting to reimburse. We do know that the state of Illinois is fighting for reimbursement for these services, as well as the nation is starting to look at that as well. So I told you a little bit more, or a little bit about the Swedish American program in the beginning. One of the requirements from the Illinois Department of Public Health is that the mobile integrated healthcare program must be approved through them, and it has to be run through an EMS resource hospital. Our EMS resource hospital happens to be Swedish American. They did a pilot program for a year, and they had one paramedic, and again, they had that relationship with that complex care manager or that social worker that was very successful for them. They started their program in August 2016. Each patient is enrolled for 10 weeks, and they focused on housing. You know, was the house safe? It wasn't necessarily the safety of the person in the house, but it was, you know, are there rugs on the floor, and do those rugs need to be lifted up because the patient is now walking with a walker? Do they have access to food? You know, have they been prescribed a low sodium diet, but they live in a food desert? Do they have their medications? Were they able to get the equipment that they needed at home, or are they stuck at home because they don't have the equipment to get out? Are they making it to their appointments? Are they new to the area, and have they secured a primary care provider? And what about transportation back and forth to their medical needs? So the data that they showed was pretty impressive within the first year of the program. Their patient population had an average of 13 ambulance rides per year, and they were able to reduce that 42%. Their ER visits were reduced by 35% even after the patient had finished the program. They had a 40% reduction in their admission baseline. And what was most impressive with the Swedish American program is with the 100 patients that were enrolled in the program in the first year, they were able to reduce their readmissions 100%. So patients were not being readmitted to the hospital during that first year, and in the 10 weeks of the program that they were there, that paramedic was working side by side with them, with the complex care manager, as well as after the program. The Rockford Fire Department did a very similar cost analysis for cost avoidance, and they feel that they actually realized $373,000 worth of savings by not deploying the rigs as much. And then the cost avoidance for Swedish American was over $900,000. So the EMS Resource Hospital, one of their responsibilities is to share some of their work with us. So some of the forms that we will be using in the program, the resident safety assessment, the consents, the intakes, the medication forms, et cetera, will all be shared between us and Swedish American. It's not like we have to start from the beginning. We have a program that we can slide right on into. We'll be measuring how many calls from that high frequency group that we're able to reduce within the pilot of our program. We'll be measuring that improvement of health within our population, within different patient outcomes. We'll be surveying the patients to actually see what they feel about the program. And we'll be looking at the hospital readmission rate. And we will be looking at the per patient episode cost, whether that pertains to putting a rig in motion and the paramedics, or whether that relates to FHN. And the community benefits, besides what the benefit is to the patient, really is pretty vast. We know through various programs, including the Swedish American Mobile Integrated Healthcare Program, there's multiple grant opportunities. And the more that we can partner together, the more that we're going to see those grant opportunities come forward. We also know from Swedish American that there's additional volunteer opportunities for these patients. One of the things that Swedish American said is they found that these patients wanted to get outside of their houses. They wanted to do something different. It was the people connection that they were missing. And so this may not be the volunteer if you need somebody at 10 o'clock every Tuesday, but it is the patient, the person who's going to be a reliable person. And then we also want to connect them to resources and address their medications. So we really think that our program would have some success, and we would like to actually implement a pilot program in first quarter of 2019. So thank you again for your time, and if there's questions or comments, the chief and I would be happy to answer.
Alderman Parker.
Yes.
So one thing that we've had a lot of discussion back and forth between the chief and I and Attorney Cisnowski about this with the labor agreements, and also talking with the Rockford Fire Department. We will need to get, before we move forward with this, we will need to get an agreement with IAFF as we go forward. And because of some issues dealing with paying for it and the way it falls into the pay and the relationship. And we've gotten the lessons learned from the Rockford Fire Department chief. But I just want to make sure that everybody's aware that that's the next step here is approaching the firefighter union as we move forward into this program. And there were some challenges that Rockford, that they actually got the state representative from IAFF involved into it. So that's why we want to move forward in that direction.
Alderman Parker.
Alderman Clem.
Mr. Martinez, really appreciate the presentation. Lowell mentioned this to me months ago, and I thought it was an absolutely fantastic idea. Just went from talking to other fire chiefs, and when you take a look at the numbers of frequent flyers, so to speak, that you have. The only question, one of the questions I had, and you basically answered it on the last one, but I think it's something to overcome. I got two questions. The last one being here on when you said about people meeting people or getting out to be social or this or that, how much of that is part of this 113 visits? You know what I mean? How does that enter in? And the other question was just basically, how does the firefighter operate or the paramedic operate? Does he operate out of like one of your small vehicles, or how does that work? Just a question.
So one of the things that we find is with our frequent flyers or our familiar faces is that many times the needs are truly, it is a relationship. Sometimes it's food. Sometimes we have patients that end up coming to the emergency room because we're the meal that they're able to get. So one of the things that we will be working with, and especially the complex care manager nurse, will be working with those socializations. So not that we want to get everybody in a group setting, but how can we get people involved to the level that they want to be? Because we do know that personalization and relationships and trust are going to be what helps that patient become engaged in their own care. And we know that that ultimately will impact the overall health of the community and the individual.
Thank you.
And as far as a vehicle, we have staff vehicles available, and what we'd use is one of those vehicles to go out and make the house visits with the complex care manager. So we do have those in place, and some of those costs were built into our costs going into this as well. And just to follow up real quick, Lowell, on the IFF, they have been approached, and they are very receptive to this program because they do understand what it means for this community. So I have a good feeling about that as well.
Alderman Ross.
Yes, yes, Chief Allen, you just answered one of my questions about, you would be making home visits, correct?
Correct.
Okay, and then what hours would the paramedic, what hours would they work? I mean, how would that be established?
At this point, what we're going to do is it's part-time. We're going to baby step into this. So it'd be on a part-time basis. So we'd use one of our firefighters that's already, we wouldn't have to hire anybody else. We're going to use the existing firefighter that we have. and they would basically be 8 to 5 hours, couple days a week is what we're planning on right now, around 20 hours a week, but it'd be during the daytime hours.
Daytime hours, okay, follow up. And with the events that we have going on in the third ward right now, Ask for the Water, how would that task be done?
So, yeah, if there'd be somebody that's in a neighborhood that's underwater, they have an appointment on Wednesday, tomorrow. How are we gonna get to the house? Is that?
Yes.
You know, and that's some of the reason we're using the fire department. We know those neighborhoods, whether it's a water issue or it's a different issue in another neighborhood. You know, we're in tune with the community, we know what's going on. So, I mean, even if we have to get a boat and get in, or waiters, or whatever it takes, we'll get to that patient to make sure that, or get them out of that situation. Maybe they have water in their basement and they're not in a flooded neighborhood. At least we could get access into that property, find out, hey, this is not a good living condition, whatever that issue may be, and take care of it.
Thank you, Chief Allen.
Chair?
Yes, go ahead, Mr. Peter.
Thank you. Thank you for the presentation. Thank you for bringing this forward. I think it's an idea that, I like the innovation on it, and it's an idea that can really, it seems like one of those things that can help the community, can help the, obviously the business, the city, the departments, and things of that nature. I know we're at the point where we're still, crafting the idea, but if you're looking for some feedback as, whether the council thinks we want to go forward with it, certainly I'd be interested in moving it forward, getting some of the final, working out some of the final details and the kinks that are always do that. But as far as a concept, and I'm certainly in favor of it, and I appreciate you bringing it forward. Thank you.
Mr. Chair.
Yes.
Thank you.
Bradshaw.
I want to thank Ms. Martinez also for her presentation. It was very concise. One of my questions, Manager Crowe already answered on the IAFF agreement, and some of the time commitment of firefighters was covered. To the patient care agreement, though, you said a high percentage of the patients that are repeat riders in the ambulances, perhaps this would suit them best. What percentage of those do you think would do this, and how do you get them to agree to this program?
So that's the benefit of Swedish American going before us and setting the stage. So they truly, in the beginning, they found that they had to be very crafty. They did the usual approach, and they said, Ms. Brashaw, we want you to be in this program because it's fantastic. And Ms. Brashaw said, no, thank you. And so they've really had some learning lessons about how to approach these patients, because we know these aren't patients who necessarily want us coming into their homes. And so they've really established that relationship and trust. Some of that is having that complex care nurse meet with the patient in the emergency room, start to develop that relationship. They did find that, again, there's something about the fire department uniform that establishes a trusting relationship. And so they're willing to share some of their golden secrets with us. They found in the beginning they had about 25% of their patients that were participating in the program. They are now up over 80%. When they identify a patient, they are able to get into the homes and work with these patients for at least 10 weeks in more than 80% of their population. So they've been very successful.
Thank you.
Alderman Parker, if I could do a follow-up. I really appreciate the way you put this, to put yourself in this person's shoes. It's 53 years old, and how you went down that line. I know Lowell is blessed with this as I am to go to the VA on different occasions. And I believe that we see many of these people that you're talking about here sitting in chairs up there. And just from all kinds of different things that have happened in their life, I'm very fortunate that I haven't had a lot of those things, but at first when you were talking about all these things, I thought you got a hold of my medical records.
You too.
But thank you. I appreciate you putting it in that perspective.
Thank you.
Alderman Busker.
Yes, I'm glad to see this coming forward after 10 years in EMS. I understand, where you're coming from. We knew these patients' life stories, and they knew ours better than our own families. My question is have they seen any studies after
the 10-week program, how many people they've had to revisit, or how successful after they're graduated, well, for lack of a better term, graduated from the program, that they keep motivated outside to keep their health going.
So Swedish American has really looked at their patient population, and they keep studying that same, the first patient that was admitted, they keep tabs on. In the beginning, they had some patients that would graduate, and then maybe 4 weeks later, were showing back up. Their success rate has been really 2 times in the program, and they have not seen any increase in the use of either 911 or the emergency room. It really is that connection to resources and making sure that that patient, even after the 10 weeks, has somebody that they can call back to and say, hey, remember that person you told me about? I can't get a hold of them, and we can still provide that either through the complex care manager or through the paramedic. So again, Swedish American is taking care of the patients. So they're not just taking care of their own, they're taking care of Rockford Memorial's patients as well as OSF's. And we would be doing the same for Freeport. We would not, if a patient has a primary care at Monroe, we're not going to exclude them from the program because we want them to be successful. Does that answer your question?
Yes, thank you.
I have one question, if there's no more. What kind of time schedule are we looking at if the council approves this before it's up and running and full speed?
We'd really like to do a pilot or begin a pilot in first quarter of 2019.
Thank you.
Chair?
Yes, Alderman Chesney.
Chief Allen, if I heard you correctly, the overall impact on the budget is going to be in the pilot program reasonably small?
$56,000 is what we anticipate at this time. When the Rockford Fire Department came up with their cost avoidance, it was 1 year into the program. So to get tangible numbers, we're going to have to go through the pilot a little bit to glean that information. But out of the gate, using what we could get from the Rockford Fire Department and putting our numbers together, we came up with that $56,000 out of the gate.
How many patients do you anticipate being a part of this program?
Well, we anticipate starting with 10 to 20 for the first initial pilots. Generally, the Swedish American has suggested that you have no more than 20 in the program in a 10-week period. Now, with the understanding that 10 weeks continues to change and people come off the program and on the program. So, but they do feel that in order to be successful, and especially with a part-time program, that we would have to limit to 20 at any given 10-week period.
Thank you.
Alderman Perk.
Alderman Tent.
I'd like to make a motion to move it forward to the council.
Second motion by Alderman Clem, second by Alderman Ross. All in favor?
Aye.
Aye.
Any opposed? Okay, thank you.
Thank you very much.
Thank you very much.
Okay, item number 8 is a discussion of real estate lease agreement with Heritage Aero, Inc. at Alberta's Airport. Manager Crow.
Thank you very much, and I may call on Daryl as the expert on the hangars out there. And I know we've also, Dennis has gone out there and looked at this. So we have reached an agreement in principle with Heritage Aero to move into our hangars, O hangars, and also rent one of the M hangars as a overflow. These would be, they're looking to go to a 10-year lease at $600 a month for the first year and $700 a month for all remaining years. This is an increase of, significant increase over what we're getting there. These hangars are actually not rented right now, and this will be filling additionally. And we also expect with the moving of Heritage Aero here, an increase in use of both types of gas, which will again generate revenue. We also expect additional aircraft to move here. This is his business is, Daryl, you want to talk a little bit about his business, what he does? with his overhauling of engines and.
Yes, Heritage Aero right now is, has the maintenance facility in Rockford. They're into, they basically started out with Warbird type equipment in here. So it's the top end of here. It brings in a large amount of income for it. They've graduated into now we're starting to run out of the World War II Warbirds to remanufacture and run in. So now the end thing is the jets in here. So they have a lot of companies have L-39s, MiGs, have one with an F-86. So you know it's the type of equipment that's the larger end of it in here that they're mainly doing. They also do smaller things. They kind of specialize in Piper's twin Comanches. So they're the specialists in that. So they do programs for the pilots in that particular airplane every year in here to bring them in for recurrent training and everything. So there's a lot of aspects to it that they do. So they'll do any maintenance. So basically they can do anything that I'm doing out there too, but they're kind of into the top end of the line.
So the other thing that's good about this is they will bring additional aircraft in here. He also does once a quarter, does training sessions with these with the maintenance crews for these aircraft. They'll be filling into our hotels, eating out of our restaurants here. Additionally, when he works on a lot of the private aircraft, they come in for a period of time, and the pilot stays here with them again, filling our being able to eat out of our restaurants and going into the hotels. He initially was talking about moving 13 employees, has had a couple employees that have backed out.
He's had a couple employees that says, I'm not moving to Freeport with you.
So he's going to have about 10.
Somewhere else. But there again, as he starts going and starts redeveloping it, well, he'll probably hire some back.
Yep. So what we need is the other part of this agreement is that, and this is Dennis has cost us out at about $39,000 to $40,000. We install a double door fire door between the hangars to allow access. Install a hangar. He works year round. Heater into the O2 hangar. Finish the bathroom in the O1 hangar. Run water to all the hangars and connect in the bathroom. Connect the sewer for the bathroom. Install electricity within the hangars and provide a 3-phase converter as well as a deep sink. We're also going to put a 10-spot gravel parking lot out there with a fence around it initially. So I said it was in the area of about $39,000 to $40,000. And our guys would be doing this work, and this would have to be completed prior to his move-in. His official move-in date would be 1 January, but he would start moving equipment over here probably in November.
Chairman Chesney?
Thank you. Daryl, are the accommodations in Rockford similar to the proposed ones in this?
Yeah, the thing is, we've got, that's a 3-unit hangar. Each unit is like 65 by 62. You know, in measurement. He's in a large hangar over there that's roughly about 100 by 100. So we come out with about the same floor space for him in here. It's kind of divided up that way. But that's the only thing we have available. So yeah. He's willing to work with that.
And go ahead. I'm sorry.
Thank you. Chair, if I follow up?
Yes, please.
Thanks. And Daryl, what is he paying now with Rockford?
I'm unsure of the exact fee. There's a lot of different connections with it. He has to pay the real estate taxes, which has gone up on it. There again is something that's changed along the way on him. Some building maintenance in here, so it's kind of like they've pushed him out is what they've done. So
and we actually have in the agreement that he will pay a portion of the real estate tax into this agreement as well.
So what we're right now, if we were to rent that building out in here, there's 3 units. Right now, the rent is $474 a month for each unit, and we've upped him to $600 a month for each unit.
For the first year.
Because of the things that we're installing, and that's for just the first year. And the second year, that goes to $700 a month for each unit. So we're getting a good increase in what we've had.
Yeah, and one final comment. What I like, Daryl, that, historically what we have a tendency to do is we build and hope they'll come. I like the idea of actually having secured somebody
Right.
contingent upon our agreement to do some changes. So that's certainly encouraging, and I think it's a good move forward.
Yeah, I think it's gonna work out really well.
I agree.
I've already seen is people interested that are going to come over from Rockford to follow that business. And I think within the first year or so, we're gonna see all of our empty hangars filled up, because that's gonna generate that. I mean, it's a win situation all the way around.
And how long's that been since we've been able to fill all our hangars?
That goes back about 8 years ago that we had everything filled and we started, losing things off with some, a lot of problems, the economy along the way. So this is a big increase. We've started right now starting to fill more up along the way as we're going in here. So this is going to just push us over the edge onto it in here. So we've had one hangar that's been occupied free of charge for those years. So that's going to come up to, we're getting money for it. The other two have been rented off and on, but nothing on a continued basis here. So here we're going to have a continued basis. It's rented. That's a pretty good situation.
So this is a 10-year lease with an automatic, not an automatic, but an additional option to lease it for another 10 years after that's up. One of the other things is he said in Rockford, because Rockford's becoming more of a cargo, he likes to have his independent airport so that he can fly. His clients don't feel like they're fighting for ground space and landing. So that's one of the things he likes about the airport. I think this is a good move forward, and I think it will really cause the airport to grow out there.
Mr. Chair.
Mr. Chair.
Bradshaw.
Thank you. I want to thank you, Daryl, and also Manager Crow for finding a way to come up with a yes on this for this company that wants to come to Freeport and promote our airport. I think it's so important to get these hangars filled, and especially a group of them, the 3 units together. And one of my questions was, I think you kind of answered it, but not exactly, was how long had those 3 units remained empty? And I think you said they're rented periodically on and off.
Right, yeah, they've been, the one center unit has been an agreement to store a group of helicopters out there at free rent for over 10 years. And the other 2 have been rented and then moved out, rented to someone else, back and forth, and in between remain empty.
Follow up?
Yes.
Oh, I'm sorry, Manager.
No, I was going to say about the free hangars, we have been in contact. This is through the county, through the storage of that you see the helicopters that are now sitting out at the jail. Some of those were the ones that were in there, and we're getting the rest of them moved out. So,
Sure. Go ahead, Tom.
Look, a couple quick things. Just from being an estimator, all I want to do is make sure we got everything covered. It seems like what you quoted that you said to put all this stuff in seems a little low to me. Okay, I just want to make sure you're covered and everybody's happy with everything. That way, then we don't end up with, somebody doesn't end up with a bunch of costs, or somebody doesn't end up pointing at somebody. And the other thing, and it doesn't really say how big the parking lot is or who's blacktopping it or who's paving it.
So we will be paving that, but we have to wait until the spring.
Right.
But that is part of it. That is not actually in that 40,000 number. The asphalt itself isn't.
so it's the gravel, strictly the gravel parking lot.
As for the rest of it, I mean, with our guys doing the work, we don't have to pay that premium on salary for wages for any contractor to come and do that kind of work.
Okay.
So that is keeping the cost low. We've actually got like a picket list per se from Menards. We've already got set up. So as soon as we get the contract passed, if it were to pass, we've got that already set up.
Okay. Appreciate it. Thank you.
Alderman Busker.
Yeah, I'd just like to make a motion to move it to the regularly scheduled council meeting for consideration.
Second.
So just for the council's information, this will, talking with Aaron today, this will have to be an ordinance since it's a long-term lease. And so that's what you'll see is both the lease and the ordinance at the council meeting.
We can hold Alderman Chesney has.
Yeah, just a few more questions. Lowell, under real estate taxes, it says parties acknowledge the property is currently exempt. I know that we pay about $40,000 in taxes,
So what we pay taxes on is right now, the $40,000 is based upon the conference room that isn't finished,
Yeah, and that's something we really need to look into.
And
And
it's-
as I was explained in years past, it's like we could only be taxed on property that was taken out of public use. I don't know if that's true.
So what we're doing is the conference room, basically the terminal, that's what they're taxing on us based upon the price that's evaluated. And I've been in communication with Ron Kane. As you'll see, there's an 18-month period to finish that he would like to take access of it. His conversation with me was because there is this is a Heritage Arrow Cliff, is because there is a line item to him to pay the taxes if he takes over that. He is thinking about not taking that now because that's what we're being taxed on.
Okay, a few comments. Daryl, the escalation from $600 to $700 after the first year, what's the thought? Walk me through the thought process on why it went from $600 the first year to $700.
I was actually the one that negotiated that. So what happened was we initially went to him for $700, and that's what we offered him, $700. He came back and said, I'm going to be, because I'm having to shut down my facility over in Rockford, I'm having to move equipment, having to do this, can we meet $600 for the first year and go to $700? And we had already looked, the $600, I shouldn't say this here.
Okay, that's fine. Quick follow-up?
Yes.
I won't, yeah, I understand. So my question is, Lowell, I'm not seeing if $700 is the agreed to market rent, I'm not seeing an escalator in year 2 through 10. I mean, even just inflationary. Why are we not, that's...
And that's a valid question.
Because if $700 is the market rent, if that's fair market value, at a minimum, we should be getting the same money every year. Each year, we're going to be losing 2 to 5% year over year. So by the time you get to year 10, you could be losing 20% of the negotiated deal today.
And what we can do is, if that is not currently part of the contract, what I can do is go back to talk to Cliff on that, and as we go through the based upon CPI, because we have
CPI, we're not asking for a better deal. We just want the same deal we had when we negotiated.
So, I'll talk with him and see what his feeling is on that.
Okay.
So we got a motion by Alderman Busker and second by Alderman Clem, or by Peter, okay, to move this to the next council meeting. All in favor?
Aye.
Anybody opposed?
Thank you, Daryl.
Alderman 9, item 9 is the discussion of redevelopment agreement with Wagner House for the revolving loan fund. Director Zukov?
So this is, since Andrew's not here, I will take this over, since both of us were involved with this negotiation, as was Randy, Director Bucus, in it, and so he'll keep me straight if I get off the straight and narrow on this one. So we were approached, we had the revolving loan money, which is set aside. We have a little over $300,000 in the revolving loan that we can use. We were notified 14 months ago that the state was going to sweep that money at the 1st of January, but we could do up to 2 grants out to other businesses. So we advertised this through the businesses in the downtown, and we actually were approached by 2 separate businesses about doing this. And the revolving loan money, it either has to generate one job for $15,000, or it can be used for ADA compliancy, fire code. There are very specific guidelines. What we were approached with, the one developer could never meet the requirements and justify what he was going to go forward with. We're actually going to meet with him again. He was the first one to approach us. The Wagner House, Chris and Bill approached us and said, we would like to bring our unit into ADA compliancy and also fire code compliancy. Their total cost of that is $519,000. We can provide a grant of $300,000 towards that, and then they would provide the rest of that money. We will be bringing a resolution in front of you on the 15th to return that, to shut our revolving loan down. That's the first step. They cannot start taking this money until after the 1st of January, but we need to have the RDA already in place so we can execute that. That's one of the requirements for the state, and there are some other additional requirements as we go forward. So this will be putting in the fire escape, improving the elevator, making the other for ADA compliancy for the 3rd floor, and additionally doing some additional other ADA compliancy that they are lacking currently in the building, and bring Wagner House up to fire code and ADA compliancy. Randy, is there anything else you want to add to that?
I think you touched on the major issues. The one item is that under the old program, revolving loan fund program, it was limited to $15,000 per job, but because they're kind of doing away with the rules on the use of this money, so to speak, we could go $20,000 to $25,000 per job. So I think they're proposing 15 jobs at $20,000 a job, gives them their $300,000.
Mm-hmm. And questions?
Any questions? Okay, Alderman Clem.
Alderman, Parker. Got it there. Okay, a couple questions. 2 or 3 things, I guess. Number one, you talk about bringing it into ADA compliance. You talk about the elevator. In looking at the spreadsheet that you basically had, or not the spreadsheet, but the thing listed as $153,005 for the elevator, installation of the elevator, architectural fees. Are our architectural fees going to be going here in town?
Yes, they are. So Chris Fye is their architect.
Okay. And installation of egress on 2nd and 3rd floor is a pretty good chunk of change in this, but it mentions absolutely nothing about ADA compliance outside of the building and to the current entrances.
That's correct. And so when I'm talking about, they don't have an ADA access right now to the 2nd and 3rd floor because the elevator is not certified. So this would get to get the elevator so people can get to the 2nd and 3rd floor as part of this, within this building.
Correct, but you haven't solved the problem on 1st floor. That's all I'm asking. You know, you can't get up the front steps and the back is a makeshift back with no parking. What are we going to do to resolve it? That's my only question. I want to make sure that we got everything covered, number one, and that we've got inspections and everything covered, so if it doesn't work out at the end, we aren't all standing there going like this. It's basically what I'm looking for, you know.
And
that makes sense.
That does.
Okay.
That does. And that's one of the reasons why I wanted to make sure everything was captured that the council wants within the building.
Could I do a follow?
Yeah.
Yeah. It is, you know, based on 2 things that Manager Crow said. The first one was they went out to businesses downtown, you know, and nobody really came back and said, okay, I'm interested in this. And the other person I know, Manager Crow and I had talked, have been in and out of what's gonna happen, what isn't gonna happen. No, I don't wanna do that. I don't wanna open up my financials to this and yada, yada, which is all the stuff that really needs to be done, to make the whole thing work. So, I just wanna make sure we're all clean on where we're at and what we're doing when we start out and end up, so. Thank you.
Chair.
Yes.
Thank you.
Peter?
One of the things that goes into my consideration on this is kind of the state changed the rules on us here. And so this is one of those situations where if we don't use this money locally in the near future, it's gone. So I appreciate some of the additional questions Alderman Clem's asking, but I also do think at the end of the day, with this type of product, that we can get out the door and keep some of this money local.
Okay. Alderman Parker.
Yes, Alderman Ross.
In regards to Alderman Clem, I don't want to beat the same drum, but wouldn't it be required on that front of that building to like have a ramp like This Is It Eatery to allow the?
They're required to have a ramp at some place into it. Right now, they have a makeshift ramp that comes in on the back side of the building, but it's a wood ramp. It does not, it's a temporary only. I can refer to my ADA compliancy director down there that knows more about the ramp's requirements, so.
I have not looked at their ramp, but to do any kind of a remodel on that building, they would have to make it accessible from the parking lot all the way to the actual renovation they're doing. So if they were to renovate the third floor, they would need to actually maintain access from the parking lot all the way to the third floor. So yes, they will need to have access from outside to inside for that permit to get past Sioux City Hall.
Okay. Follow up.
Yes.
If they're going to do that, wouldn't that be have to be done with either wood or cement?
I mean, you can have that built with wood, but it has to have a non-slick surface. So there would actually have to be something on top of the wood as to maintain the traction coming up that ramp. And I'm not sure how tall it is, but if there's a pretty significant change, it's going to have to actually be a switchback ramp. So that way there is a landing in the middle for that rest period.
So they do know this.
We'll have this discussion with them as we go forward.
Okay, that'd be great. Thank you.
Alderman Park. Two things, I guess, as we mentioned that, and we want to keep in mind too, it is a historic building, so you don't want to put something in that's, I mean, really going to butcher the whole thing up. I think there's something that neatly can be done that'll solve the problem whatsoever. The one thing, Dennis, will we see a set of approved prints and a set of stamped prints on this, so we all know what's going to happen?
That's the reason why we are demanding in this project, we made sure, based upon previous experience here with this particular developer, that's why we're making sure they have architectural plans on here as we move forward with this.
Follow up if I can?
Yes.
And this is just a question from the past, what you know of one ramp we put in that we never got paid for. And I want to make sure, is there anything that we need to do there? Or how is our money being worked with their money? So you understand what I'm saying? So at the end, they meet the end product and.
So the way the way the RDAs are working with, that Aaron and I put together, it's a reimbursement RDA. So they give us receipts for what they are doing, and then they're reimbursed out of that money.
And we do inspections as we go
We
with Ben and with Dennis. Great. Okay, thank you. Appreciate it.
Any other questions?
Do you need a motion?
Need a motion to move this forward. We'll have it, this will be a resolution as well.
I'll make that motion.
Second by Alderman Chesney. All in favor?
Aye.
Any opposed? Passed.
Chair, I missed who made the motion.
McLennan.
You get the second then, Debbie? Did you get the second? Okay, you got that. Yeah. Okay. Item 10 is a discussion on the sidewalk requirements at Liberty Village. Manager Crow.
So I'm going to talk a little bit about, so in 2002, well, let me start. 1997, when we initially established the plat for Liberty Village as a guidelines to accept the plat and accept Liberty Village into the city limits, annex it, they had to install sidewalks and they had to complete the roads. What we have, and then in 2001, the city accepted the plat. I want to make sure I get the right brief. It's the bridge. So in 2001, the city accepted the plat from Liberty Village and annexed it into the city. But at that point, we said, we'll accept the plat and annex you into the city with the understanding that you will finish all of the subdivision requirements. And that is put sidewalks in throughout Liberty Village. And since that point, we have had one individual struck and killed within the vehicle walking Liberty Village. There is a 12-foot utility easement existing on the property. Why this came up is they're beginning to build out there again. They've pulled building permits to build 3 additional units. They've already are getting ready to close on 1 unit right now. And when we went out there and told them that they had to put a sidewalk in on that new unit, the manager balked at that because he said he never needed to put sidewalks in. And then Steve and I met with him and said, we do. But before we showed him the ordinances, and he had said, well, the residents don't want it. Well, I've gotten 3 or 4 emails from residents out there that say they want the sidewalks, and I know some other people have had contact with him. And what we're just looking to make sure, there are 3 options, and I want to make sure before I tell him that he has to put sidewalks in, that the council's perfectly, that's the direction, that's what the ordinance says, that's what we have to do. Because what he wants to do is complete a walking path or a bike path between, there is a sidewalk on Navajo, and there's a sidewalk, my map's down there on the back side. I don't know if I've got the map. So right there, there's a sidewalk on Navajo and one on Canterbury. And their phase 2 is that they've never been built because they haven't completed it out. Starts right where that field is. He wants to complete the 2 paths, but connect those 2 paths and say, look, I've met my requirement for connectivity. Our feeling is we have the 12-foot easement. We have the requirement. We believe that he should install sidewalks throughout to make this safe. If they didn't want to do, we get traffic along through there, people travel through there. If the Liberty Village developer didn't want traffic to drive through there, he should have never had the city take custody of this and have dedication. But so I wanted to give you the 3 options. The one that he wanted to do, proposed to us, Steve and I, when we met with him last week, go back. The one we think is to complete the sidewalks. And then if your desire is not to enforce the sidewalks, we need to change our ordinance or resolution in here. It was actually a resolution that said that we passed that said that in 2001 the council passed that said we will accept the dedication of this with the understanding that you will move forward and get complete the sidewalks in the subdivision. So
Alderman Clark.
Questions? Sure. Alderman Clem?
A couple things enter into this, and it does go back. Needless to say, I'm old, but I wasn't here in 2001, so I can't verify that. But I've talked with every person that's been involved, from mayors, from engineers, from street superintendents, to whoever and ever, and nobody can come up with anything that has said to Liberty Village or that there's anything signed that the sidewalk shouldn't be there, okay? The other thing, and we received one tonight from somebody I had received an email on before requesting sidewalks be put in there because of people going out, being able to walk, getting from point A to point B. At one time, I held they invited me, some of the people that came to, that were at Liberty Village, asked me to come and talk to them about some stuff. And one of the things, needless to say, was sidewalks. And one of the things that they said is they can't go out for a walk. You know, they can go out for a walk and go so far. This always becomes one of these things that you can end up putting a sidewalk to nowhere in some place, but later on down the line, when somebody puts something next door to it, now we got an issue because the sidewalk isn't there, the land's closed up. Nobody's going to go back and pay for it. You know, I'm sorry I missed that meeting that Lowell and Steve were at, and I apologize to Andre for not making it. That's 100% my fault. But I believe if we look at the total overall situation and the number of people that are out in that area, not necessarily just in Liberty Village, like the guy that wrote the email lives, it's not up there now, but lives on Lake Spur, and he said, I can walk 3 blocks on sidewalk. You know, so I think it becomes a safety issue. The only thing I was, and this was just a thought process as I was looking at this, and I said, well, if we do say, okay, the whole thing's got to have sidewalks, then do we do it by, as he does these units now, he puts in the sidewalk and we come up with a plan to do the others? Or how do we, you know, what do we do?
So what Attorney Cox and I did, because of the expense of putting sidewalks, we need to have an agreement in that he will have with a deadline that you will have the sidewalks. He has to put the sidewalks in on the units that he's building now and then give him a period of time. And what we were thinking was a year to 18 months to finish the other sidewalks throughout, because we're coming into the end of the building season here. So he'll have to do it next year. Andre is actually not the developer, so he's got to go back to the developer. But one of the things we looked at was, because there is a 12-foot easement, there is room to put that sidewalk in. And then he additionally has to go out and tell each one of the homeowners that he's going to be taking, the developer's going to be taking the sidewalk in. So what we believed was a year to 18 months was enough time for him to finish out the sidewalks.
Follow up if I could?
Yes.
One of the other things in the conversation, and you answered it tonight to me before we started, but one of the things was talked about or mentioned at one time was maybe like a multi-use path. Now, we talked about that gets to be much more...
It's much more expensive.
Much more expensive to do, you know, without a doubt, and then we're going to get into the maintenance and we're going to get into all that type of stuff. But what they actually proposed doing is a bike path type thing in back.
Between connecting them, that's correct. So the sidewalks are a 5-foot requirement. The multi-use path is a 8 to 10-foot requirement, and it's of a different aggregate and quality. It's actually paved, am I correct on this?
I mean, a bike path can be concrete too. It just.
But it has to be, and the other issue is then we end up, if they put a bike path in, then it becomes our responsibility in a lot of the areas in the city to pave, to maintain, where a sidewalk is the responsibility of the homeowners to maintain.
Chair?
Yes.
Thank you. And from my understanding, if you're talking on a bike path, you're talking about from Navajo, where the sidewalk currently ends in between Seminole Drive and Fox Point, going back what's now the wooded area connecting to Canterbury.
That's correct.
So
That's what he's proposed.
And that would not address the lack of the sidewalks from Navajo Drive, from where it currently ends, all the way to Parkcrest, and from Parkcrest down to Canterbury, correct?
That's correct.
Okay, well, we can continue then?
Yes,
A little follow-up? All right. I mean, this isn't a situation where this is some surprise. It's been in there for a long time. I don't think it's good for the safety to have the pock mark in regards to that. I don't see that the bike path solves any of the issues that exist on it, and I certainly don't have any appetites to change the resolution, so I'd be in favor of enforcing it as it's written.
Alderman
Okay,
Brashaw.
thank you. And Manager Crowe, I echo his, McLenathan's statements in the fact that I don't think there should be an alteration and it should be enforced. For public safety, if nothing else, there is a lot of public enjoyment in using the sidewalks with the elderly. My mother-in-law cannot walk anywhere without the use of a sidewalk or a hard surfaced area, and she's 90. My grandmother is 96, and she has the same problem. They don't live in this area, so I'm not using them specifically as that example, but they cannot walk on grass because of the unsure-footedness. And on Navajo Drive, the cars really zip along. I know I live near that area, and I've walked along that area, and I don't like walking in the road, so I usually end up walking in the grass. But I do know that it really curtails the elderly people that live there. For their enjoyment of life and public safety, I think we really do need those sidewalks. Thank you.
Good.
Alderman Clem.
Just one follow-up. Dennis or Lowell, either one. We've talked about this, but I believe, tell me if I'm wrong, the sidewalks are required on one side or are required?
The plat requires sidewalks on one side. That was what the subdivision requirement is.
Okay, so he's got Navajo Drive, he's gonna go up one side, Navajo Drive, the other side doesn't necessarily need.
That's correct. That's what the requirement is from the subdivision.
And that is, whose discretion is that to? Is it?
It's really falls into, Ben, yeah, we'll get it directed, but Ben's the one that goes out and inspects it.
Okay, thank you.
I got a question. So what we did, we have minutes from the meeting or anything from 2001, so
We actually have a resolution.
So 17 years ago.
17
put it
years
in
ago.
there, and the city has done absolutely nothing in 17 years. Now all of a sudden we're coming and saying they have to do it. I think we're gonna look foolish.
Well, what Andre told me is that every time that they've had a new mayor or a new administration come in, he has the same question come up. And this is not, and he wants to get resolved so he doesn't have this going forward. And the resolution, it was just never enforced. Part of the problem was there wasn't a unit built out there after, this is the first unit that's been built since 2008. And he's got building permits pulled for 3 more units.
Don, if I could, I think part of that goes back to some change in administrations. But like I said to begin with, I've talked to everybody involved in this, and there have been other alderman people asked for this at different times, and nobody has ever come up with anything that says they don't have to be there. And if we say to the developer, okay, show me the letter that says you don't have to put them in, I don't think he can come up with it.
And we asked him for that, and he couldn't come up with it.
Okay, what do we do? My question is, what do we do if he don't do it then? And he argues that they haven't done it for 17 years, so what do we do?
The issue is we don't issue occupancy permits for the buildings he's building.
The one he is building, but not the ones that are already occupied and stuff.
That's correct.
Okay. Any other questions? So which solution do we want to do here?
Well,
Alderman Chesney?
I would agree with Peter and Tom and Sally. I do think that we have had tradition of not following our ordinances, but that certainly doesn't relieve the responsibility. It was disclosed. It isn't like we're changing the rules midstream. We're just actually doing what we said we were going to do, and that is enforcing the guidelines that were agreed to, albeit 17 years ago. So I think it's refreshing that we're actually following our ordinances. So it looks like the builder is trying to defer the costs, and it seems like there's some safety issues that are concerned. It seems like the residents want it. The only person that doesn't want it is the person that has to pay for it. Mm-hmm. So I'm certainly not empathetic to that, because the agreement was, when the subdivision was established and platted, that this was the rules. So I guess we're able to defer the cost for the first 17 years, and now we're asking them to finally do what we all agreed to. So
is that Alderman Ross?
Yeah, with all due respect to the person that was killed out there, I think we need to go ahead and do it I don't want to see it. I was coming back from Pearl City. I was coming down West Stevenson today, and I seen a lady walking on the side of the roadway there. So that was that's just not good. You see them walking there all the time, but then they jump in the grass. So with all due respect to the person that passed away out there, I think this is something that needs to be followed up on and done, taken care of in the question, in the story.
Alderman Parker?
Yes.
This isn't just necessarily a sidewalk concern, but whenever those sidewalks were to hit a driveway, the driveway would have to be brought into compliance as well, because would be considered new construction. So that ADA path that's what they would be building. So any driveway that is currently out of compliant would actually have to be rebuilt to be in compliance with that section as well. So I haven't been out in that area in a while, so I'm not sure if it's sitting over 2%, but that's something that we would have to enforce as well as that sidewalk is coming around.
So I guess somebody needs to make a motion, so I'll make a motion, NR1 to complete the sidewalks in Liberty Village and to work out an agreement between the developer and the city as far as a time frame and how and where it should be done and a plan to do it.
Second.
Motion by Clem, seconded by Busker. All in favor?
Aye.
Aye. Anybody opposed? Okay.
I've got the last
Oh, you got the last, okay. Item 11 is the,
that's what'll teach me to not have a department manager.
is a discussion of the cost of the Demeter Bridge replacement. Manager Crowe.
All right. So, why didn't it come up? There we go. All right. So, we've got the approved plans. I forwarded these out to you for the Detmer Bridge. And then Mike's been giving me, I'm hoping these are the last figures. He gave me updated figures on Wednesday to come forward with it. And just to give you this, just giving an idea, this is what we're actually gonna move the road out a little bit on the park side, and then there's gonna be a culvert on that side, and additionally we'll have a culvert, or no, there is no culvert on that side. The culvert's on the Detmer side. The bridge actually has to be raised 5 feet because this sits within a floodway, and the state's requiring us to raise the bridge. And let me say, the one thing about raising the bridge, we would have to raise the bridge whether we're a walking bridge or a road bridge. So this 5-foot requirement is a requirement, as would be the culvert being installed, because this being a floodway. So, when we initially presented this to you, the cost of the bridge was $1.3 million. What's happened here is, so the change to the bridges, raising the bridge 5 feet. Initially, we thought the bridge was only going to have to come up 2 feet. What they were requiring us to do is go 3 feet over 100-year flood requirement. The other thing is so when we'll just go through all these. The bedrock on right now, the footing for the bridge on the park side is a free-floating footing. What that means is it's not anchored into anything. So we're going to make sure, the comment from Mike, Leslie, and Will Hoffman was they were surprised the bridge hasn't come down on us already because of that. So we're going to have to requires shaft foundation. They're actually going to have to drill and put shafts down in bedrock in there. Additionally, a culvert, as I said, had to be added on the east side of the approach for the 100-year floodplain. We are also seeing an increase in cost in steel. Bridge steel that is not currently being produced in the United States. Steel only is being produced, it's primarily being produced in China and is being affected by the tariffs, and they see an extensive increase in the cost of steel for bridge steel. Those are the specific. So the total now estimate is 1.9, almost $2 million. This does include the contingency into the bridge.
one of the things that was a requirement by IDOT as we went forward on this bridge to get the bridge money is we are required to have this bridge also available for passage of emergency vehicles. All right.
Your computer's giving me fits here. All right.
I got it. All right. So, 20%, so our 20% match is $393,780. This will be made up through a combination motor fuel tax and water and sewer. I knew that there's been a lot of discussion. What the water and sewer was, is the reason we have to take this bridge down to begin with is we have one of our worst water mains that goes underneath this bridge. And in examining that water main, it's actually, the footings for the bridge have been poured around the water main. So the only way we can to replace this water main is to take the bridge down. So the figure is, so the water main portion if we were taking the bridge down to replace the water main along with the water main, it would be about $450,000. If we're putting a walking bridge, it would be the $450,000 plus an additional $400,000 into this. The money that we're taking out of the capital improvement fund we've already budgeted into the fund to replace the water main, and that's part of the work that we're going to be doing as part of this bridge replacement. And that's the whole reason we're moving now to do this bridge replacement so we can replace this water main along Detmer and into Gladewood area. So that's where that cost is coming from. And so it is still cheaper from a city standpoint to get the grant and pay $393,000 on motor fuel tax and capital improvement than it is to tear the bridge down and put the new water main in or building a walking path. But I want to make sure the council is aware of the increased cost here that is going forward. So I'm standing by for any questions. And Dennis is too.
Chair. Okay, first off, let's address the water and sewer capital improvement aspect of this. Under any option you have here, it's good, we have to replace the water main. So it's either we demo the bridge and replace the water main, we put on a pedestrian bridge, replace the water main, we put on a vehicle bridge and replace the water main, correct?
That's correct.
Right.
Okay, and under each one of those scenarios, is the cost to replace the water main going to change?
No.
And are we going to be paying for any additional dollar for that bridge through, or any dollar of that bridge through the Water and Sewer Capital Improvement Fund?
No, it's strictly the amount that's being paid out of the capital is to replace that water.
All right, so when we say up here, covered through motor fuel tax and Water and Sewer Capital Improvement Fund, the only portion that's coming from the Water and Sewer Capital Improvement Fund is to replace the water main.
Yes.
Yes.
All right, and to continue then, so we have three options. One, first of all, every option includes this bridge going down because we have to replace the water main, correct?
Correct.
And before we get back to that, we recently went through and mapped out the entire water main replacement that we need to do for the entire city, correct?
That's correct.
And as we did a portion of that, we identified what are the ones that are in the worst shape throughout the entire city and planned our work around those that were in the worst condition, correct?
That's correct.
And so when we're going through this and we've identified that this is one that has to come down and this bridge has to come down, we're left with three options, correct?
That's correct.
Option number one, take down the bridge and replace the water main, and that's going to cost us around $450,000, correct?
That's correct.
And that is not eligible for any grant funding whatsoever, is it?
That's right.
Option number two is to put in first of all, take down the bridge, put in a pedestrian bridge, and also replace the water main, and the approximate cost of that is $850,000, correct?
Approximately.
And again, that is not eligible for any grant funding, so every $850,000 is going to be on the city funds, correct?
That's correct.
Option number three is to put in a vehicle bridge that has emergency vehicle access that makes us eligible for an 80% federal grant, and that's going to cost us about $393,000 of city funds, correct?
That's correct.
So at the end of the day, the cheapest option for using city funds is simply putting in this pedestrian, or this vehicle bridge with emergency vehicle access that gives us the access to those fundings, correct?
Correct.
Okay. Any other questions?
Thank you.
You should have been a lawyer.
So what you're saying is you shouldn't trust everything you read on social media?
Yes, thank God.
Exactly.
Can you say that again?
Amen.
Any other?
Motion to move it forward.
Second.
Okay. Alderman Chesney made the motion to move forward. Alderman Bashaw. All in favor?
Aye.
I'll say
Opposed?
I just wanted to bring up, you know, from the start of this to where we're at now has been a considerable length of time, and there's a lot of things changed. You know, had we known, you know, starting out in this, we were going to end up with a $2 million bridge, we'd all have looked at each other and said, boy, oh boy, something's wrong here. That's a lot of money for that. But as you analyze, as Peter brought up, the way the funds are, the way the funds come from, and what you'll have when you get done. And if we were to say, okay, we don't want to do this, all we're going to be out is a whole bunch of engineering fees, have the government mad at us, and never be able to get funding for any of it.
Right.
Plus, we'll have to spend more money
Plus, we'll have to spend more money.
with no product.
Yes, Peter, you want to explain that? to
And
us?
we're, and, no, the clip note, and even if we do that, we still have one of the worst water main line, if we're doing nothing,
Yes.
we still have one of the worst water main lines sitting there, yeah.
So what you're saying is you shouldn't trust everything you read on social media?
I'm absolutely saying that.
Okay. Item number 12 is the
Did we
discussion.
get the final vote in? I've been, okay.
Yeah.
Okay, cool.
I thought we did.
Just wanted to make sure.
Is the discussion of the revisions to the building code as recommended by the building commission. Manager Crow.
So the building commission has spent the last 8 months going through the building code line item by line item. And what they are is about every 3 years, we actually haven't reviewed our building code probably in 10 years because there were terms in here there, but every 3 years you should review the building code. So what we've done is we've updated the building codes to what is currently in the current Illinois as well as federal building codes, with one exception, which I will point out to you. The International Building Code is actually on year 2015, and what you're finding is most communities are not adopting 2015 because it requires residential sprinkler systems.
Right.
So and I just saw Todd raise his eyebrows over there. So most communities are staying on the 2012 IBC code, so that is the standard, so we don't have to put sprinklers. The 2015 code, and maybe Todd has a little bit more, was developed with the idea of the forest fires that were being, because the next is 2017 code is supposedly going to have external sprinklers on residential to fight fire. So, which is going to be interesting to see how that moves forward. But all the other codes in here, you'll see the line items out. This was reviewed. We had experts from each one of the different trades go through this as part of the building commission, as well as a structural engineer, and Tom was also sitting on the building commission as the council's rep. It was chaired by me, and Ben sat in here. The one other change that we have made outside of that is the registration fee. We dropped the registration fee for plumbers down to $50 from $53, and that was because while they're not required, because they already have their state license, they are not required. We don't enforce a licensing because there's now a state licensing requirement. This strictly registers them onto the city as registered plumbers, state plumbers on here. I am standing by to talk about, the other thing is this does adopt the new energy codes, and there was a lot of discussion from the council because we actually have some builders that are some roofing that wanted the 2012 codes, because the 2015 codes, which is what's in here, requires 6 inches of foam on, if you're replacing the whole roof, it requires 6 inches of foam across the whole roof for thermal barrier. And so after much discussion, the 2015 code is what's in here. So I'm standing by for any questions.
Thank you, Alderman Parker. I was on the committee that did this, and it does basically include everything, and it also throws in the new ordinance for solar that we beat to death and went through, and which was very good, because it ended up to be a good product with everything answered. Also, everything in here from signs to sidewalks to whatever, you know, so, and Ben was absolutely extremely helpful on putting this together, and also Stan Zaravel and a couple others that were engineers. Then you had each one of the guys in the trade that were there to put their insight, and that's where we really got down to the 2015 stuff, because there was some stuff in there that was harmful to some of the contractors to try and compare bids, because most of the people that they were bidding with wouldn't allow for all the extra insulation or the extra ductwork and all that kind of stuff that had to be done. So there was a lot covered on it. I would make a motion to move it forward and open it for discussion.
Have a second?
I'll second.
Alderman Clem and Alderman Ross. Any other discussion? All in favor?
Aye.
Aye.
Opposed? Okay, now, item 13 is a preview of the new website. Director Sutton.
So before, as he's setting the camera up, we have used a local firm to actually help develop this. And Kurt, when I got here, I gave Kurt, I said, you know, our website is about as unfriendly to both Dovey, who has to maintain it, as well as the users. So I said, let's read a look at it. And I think he determined at one point we had 118,000 pages active under the old website.
118,000.
So that's one of the reasons why it was slow and hard to maintain. So he is going to bring up the new website. The idea is we will be going live on this new website. It'll probably in a couple weeks, and it'll be more user-friendly. It'll also be in line with a lot of the sites that the other organizations in the city are moving forward with. So Kurt.
All right, I'll just give kind of a quick kind of bird's eye view of this. As Lowell said, I guess I learned in systems analysis a while ago, you always have to specify that you're talking bad about the technology, not the person who maintains the technology. So Dovey and her predecessors done a great job. This thing is just the worst website there is. So we got a new one, and I think it's pretty good. I had kind of low I don't want to say low expectations, but this was part of the budget process. We kind of brought the price down on this, but I honestly can't really tell a difference between this and some of the ones that were about 80% more expensive. So I was really happy when I saw it. One of the first things you'll notice is it's more graphics and stuff. One of the best things you'll see, since almost all traffic is on the internet or on phones now, is when you squish it, which all websites do this except for our old one. It just sizes itself. So that's kind of like a tablet or a cell phone. Our old one really doesn't do that. So that's nice. It doesn't show it on the website, but one of the best things I liked looking at it, which again, all websites now do this, but say if you looked up Lowell on the site, in here, when you get down to the point where you see his phone number, maybe Lowell doesn't like this, but you can just click on it and it'll call him instead of having. Oh, wow. But that's for all staff too. If it's on there, it's just responsive like a modern site is the point of that. I'll just show you the quick framework. As you scroll down, right there's kind of your latest news. Instead of going through the list, there's a picture. Each of these are clickable. There's an article behind it to give you kind of the information you need to know right away. If you continue down, there's iWorks right out front. If you have to make a request to the city, it's right there. There's your kind of your most active people would want to communicate with. And then events. So right here you can, Lowell's got an event coming up pretty soon. It shows kind of the last 7 or 8 events next upcoming. Then for example, if you go to tonight's meeting, you get the little blurb about it, and your agenda's right there if you'd want to download it. I forget what else we got down here. Just some things around the city that you might want to do. And at the bottom, there's always the same footer, and these are links to our Greater Freeport Partnership and the codified ordinances. Like I said, it's going to be live in a couple weeks, so hopefully everybody will go in and kind of just cruise around yourself. Any questions?
So we can get on this right now?
It's not live right now, mostly because some of the legal things we have to do, like things have to be posted, or Dovey tells me it's really bad if things aren't posted, so it has to be right when it's live. So that's why we're taking our time.
Thank you. Any questions for him?
Chair?
Alderman Bradshaw?
So, Mr. Sutman, did you have to go through all those pages and make sure that there wasn't anything that you would be misappropriating by deleting them?
Because there were so many pages, we took the approach of don't delete stuff, just add what you need, because there were a lot of pages. So that's one of the things we're working on, as I said, is to make sure it's all there.
Thank you.
Any other questions? Thank you. Item 14 is public comments. Not you, Tom. Come on up.
Joey Miller, don't forget the banquet on the 10th of this month.
Yeah, I think that's tomorrow, Tommy, and I checked my calendar, and I have a meeting tomorrow night. So if you have someone else that would like to go.
I will have Matt some with those.
But thank you for the invitation. And then I have one thing to add. As everyone knows, the Salvation Army is a huge asset to this community, and they help in multiple ways of assisting, from food distribution to flood assistance. And at the request of a Salvation Army board member, Cal Westcott, he is appealing to the community for volunteers. So if anyone has time to help out with any of the flood that we're experiencing right now, the Salvation Army is very much in need of volunteers. So if you can avail yourself, I know they would really appreciate it.
Thank you. Alderman Chesney.
Thank you. And I'm sorry, just to throw out the phone number in case anybody wants to contact them. It's 235-7936. Sorry.
Alderman Chesney.
Yeah, thank you, Chair. Just under public comments, oftentimes I think we seem to focus sometimes on the negatives, but I think it's also important to highlight some of the positives that the administration and Manager Crow have executed. And I just was kind of going through, and I just would like to highlight a few because I think they're pertinent, and we have to celebrate also our successes. Today we've established, unanimously, that we are going to reconstruct a website that has been out of date for 10 or 15 years. We have now secured hangars and occupied all of our hangars that haven't been done since 2008. We're addressing a bridge that's been out of service since 2012, and we've secured over $1 million of funding for that. We are updating our building codes that have been out of date for at least 10 years. And we're asking that developers do what they agreed to do. These are all very positive things for the city of Freeport, and I just encourage these practices as we move forward. So Manager Crow, I know you've worked very hard, and oftentimes we see on social media that your path is questioned, which is a good thing. We want to be challenged, but I also think it's important to highlight all the successes that you and your team have executed, and I think tonight is a good example of those. So thank you.
Any other public comments? Okay, motion to adjourn?
So moved.
Busker and Ross. Aye.
Good job.
Everyone all in favor?
Aye.
I guess I forgot to ask that.
Good job, guys.
Nobody ever argues that.
Good job.
You think so?
Yeah. We're doing it the first time.